Easley Allen is the winner of the Ruth B. Freeman Award this year. This is in recognition for an extraordinary career in public health education, administration, policy, and practice. She's worked tirelessly over her career to reduce healthcare disparities, increase health literacy, and address unmet needs at all levels of public health. She's had a constant commitment to nursing and to public health. She has served her profession and all of us in many leadership positions. She's been the chair of the Public Health Nursing Section, the chair of the credentialing of the Public Health Workforce Committee, chair of the executive board of APHA, chair of the Committee on International Human Rights, and she's been president of this association, the American Public Health Association. Dr. Allen has an extensive record of excellence in scholarship, teaching, and academic leadership in a variety of schools of nursing. She's published widely, she's shared her wisdom widely with many different audiences, and as one of her nominators said, her service is indeed meritorious. We are indeed proud of this public health nurse, the winner of the 2008 Ruth B. Freeman Award, Easley Allen.
This is overwhelming. I want to thank Dr. Matthews and the leadership of the section and all those on the awards committee for this honor. You know, I was traveling and you know how when you come back from a trip and you have all those emails and some of them you're wanting to throw away without reading them. Thank God I didn't throw away the one that announced this award. But I got it sort of late. And when I opened it up, tears came to my eyes because to me, this is the most significant award that I can receive as a public health nurse in my career. This is wonderful to me, and I was humbled, I still am, and greatly honored by your giving this award to me. So I want to thank you all. As you know, those of you whose sections and affiliates I visited when I was president and president-elect, public health nurses to me are the greatest nurses in the world. I've always believed it and I still believe it. I love to be among you, and from Alaska to Alabama to Utah, California, all over the United States, I met with public health nurses and heard their stories and realized the significance of the work that each of you do every day and the work that each of you do who are professors, through teaching your students about public health nursing and its value. I want to thank Jean Swinney, she's not here today, Dr. Jean Swinney, who nominated me, Dr. Ann Carey, who seconded that nomination. Jean is taking care of, in fact, raising her niece, and so she's not with us today, but I certainly want to acknowledge her. I want to acknowledge some friends who've come to share this with me that are not part of public health nursing, and I saw Audrey Gotch come in, one of our past presidents, but any of you that are here that are not part of us, I thank you for coming to share this. I also want to thank Dr. George Charles and Mr. Jim Lavelle from Alaska. That's part of my Native Alaska family now, because Cheryl now lives in Alaska, and so we have a Native Alaska family. They came from Alaska to share this. Wow. I also want to thank all of you, my long-term friends in this section. Some of you I've known longer than I've known my husband. And I treasure your friendship. You know who you are. We have been through thick and thin together. We've been through the governing council experience together, through the section council, and through all the things that we've done as a section to make public health nursing visible in this association and, in fact, in the world. And last of all, I'd like to thank my family. Judy Storfield, who's been mentioned before, has been part of our family since 1974 when we moved to Michigan, and we counted her there as a supervisor of the health department in Berrien County, where we had students. I'd also like to acknowledge my sister, Cheryl Easley, our incoming president, and I'd like to just stand. Your input and your intervention, your advocacy for her candidacy there at the governing council made a difference and helped to elect her as president. So thank you all for your tireless work on her behalf. And last but not least, I'd like to thank my husband as his colleagues in Boston University as alumni call him the Reverend Dr. Gregory Allen, who's come to be with me. He could be teaching Greek today, but he's with me. I'd like to pay tribute to three very special women. First of all, my mother, Kanita Easley, who was a nurse. In fact, Cheryl and I taught her to be a practical nurse when she was a great-grandmother. And she came to many of these meetings, and the old-timers here remember my mom. She came to APHA. She loved this association. She came every year until the year that she died, unexpectedly at the age of 81. She loved APHA. I'd like to also pay tribute to Dr. Ruth Freeman. Cheryl and I actually knew Ruth Freeman. And I can't remember how we met her or when, but at significant points in our lives, she was a very special person to us in terms of a counselor and a friend. We never were her students. We never had any formal association with Ruth Freeman, but we knew her as a loving, caring, down-to-earth person who really knew us and knew what we were about in terms of our careers. And finally, I'd like to pay tribute to Darlene Johnson, public health nurse faculty at Columbia Union College, where we first learned to be public health nurses. And Darlene looked so good in that blue uniform. You all remember that blue uniform? Darlene looked wonderful in that uniform. Somehow, if I put on that uniform, I'll look like Darlene. But anyway, she was a wonderful teacher. And we did public health clinical experience as students in the shadow of the Capitol in Washington, D.C. In those days, Southwest Washington was a slum. There were outhouses in the shadow of the Capitol. And I remember with fear and trepidation going on that first home visit with the black bag. But when I made that visit, I knew then that this is what I would do the rest of my life. I loved it then, I love it now. And so I pay tribute to Darlene. I'd like to say finally, as public health nurses, you know we are faced with significant challenges to our practice for a variety of reasons that have to do with organizational structures, program priorities, as well as lack of funding. And so I'd like to challenge all of you within the context of the shortage that we now face and will face in a worsening sense as the years go by. If you looked at the study from the Association of Schools of Public Health, things are not going to get better for us. They're going to get worse. In that context, there's some things I'd like to challenge you to do. First of all, to create and restore and protect the traditional heart of our practice. I'm talking about things like home visiting, prevention, health promotion and planning, public health education, and all those things that we do that make a difference and the things that we do uniquely as public health workers. I'd like to also encourage all of you, based on the passion of our hearts right now, Cheryl and I, to incorporate human rights perspectives into the work that you do. We are good at incorporating ethics, but we also need to incorporate human rights. And from that perspective, to look at how we can work together to eliminate the disparities that are faced by many of our vulnerable populations. I'd like for us to promote health literacy, and I was so glad to hear you talk about health literacy, which is another one of my passions. I work with the Partnership for Clear Health Communication as a representative from the American Public Health Association. And as you know, we have been taken over after Pfizer withdrew their funding by the National Patient Safety Foundation. But those functions are still there. The Ask Me 3 program. Public health nurses have a wealth of work culture with regard to the elimination of health illiteracy that many times is not known. It is only passed on by word of mouth. I would encourage you to continue those efforts and to make them known to the health community at large to reduce health illiteracy among the populations that we serve. And finally, to fight the good fight against HIV/AIDS, which is again something that we have been doing, my husband, my sister, and I, with other friends, both nationally and internationally. The problem of HIV/AIDS in our inner cities, especially among women of color, is reaching unbelievable proportions, and seemingly it's been ignored because we've devoted many of our resources overseas where they are desperately needed, but we can't neglect the work that there is to do at home. So I encourage you to think of creative ways that we can recapture the heart of our practice and make it known and make it valued. And again, thank you for what you do every day to make public health a reality for the lives of vulnerable populations. Thank you very much.